Hey everybody, just getting started. We'll be with you in one moment as we confirm all streaming is happening. There it is, and this one should be. And for some reason, the streaming into Smoothie Shred is not working. So 1 second, that's why I check. I'm going to just share it from my Facebook page to make sure everybody can see it. And then we will get started. So. All right. Now we're all set to go. Hey, everybody. It's Dr. Brooke Goldner from Goodbye Lupus. And today it's Wednesday. So I'm coming in like I do pretty much every Wednesday so that I can teach you the things that you need to know about health, about happiness, about taking care of yourself, about reversing disease so you can become healthy. This right now, so let me think. We are now a week out from my anniversary. So we are about 2 days away from the official Goodbye Lupus anniversary. It will be 20 years now that I've been lupus free with 0 relapses, and not just a little bit of lupus free, not just some aches and pains or a rash. I'm talking about I had the whole thing, the rashes, the kidney failure, mini strokes, arthritis, all the things. Maybe not all of them. There's more. Lupus can do more. But I was a very sick person for a dozen years of my life. But I have been a healthy one for 20. So I can officially say 20 now instead of almost 20. And so I'm really excited about that. And we'll be going on some news shows talking about that. I have a lot of local news stations that use me as your go-to doctor to talk about health issues. And Thomas is going to join me on the next one so we could talk about 20 years. So anyway, that wasn't the topic I had for you today. But I do want to celebrate my Goodbye Lupus anniversary with you. And one of the ways I'm celebrating is by putting my classes up for free again. So right now, if you go to goodbyelupus.com, you can click on my online classes. They are super popular online classes. They teach all the information from my book, Goodbye Lupus, as well as dozens of case studies, some of which are reviewed in my book, Goodbye Autoimmune Disease, and talk about how we came up with rapid recovery and all the things. And those are very popular classes. People are still getting them today. And yeah, you can have lifetime access to them for $47. So they're pretty reasonable for life-saving classes. But right now, through October 31st, you can watch them for free. Now, in order to put them into a format that allows people to watch the whole thing for free, unlike my lifetime access where you can just click on one class at a time and watch it at your leisure, we had to put it all into one video. And so just be aware that when the first one ends, don't click out of it. The second one starts after the first one. And if you're struggling, you can click the little YouTube icon for help with that. So make sure you watch them, you share it with your friends and family, and get the information. I know not everybody out there has the ability to work with me privately to reverse the diseases. And it's why I donate my time, my information constantly to make sure that you have all the information you need to get healthy. Then it's about whether or not you do it. So make sure you do that. Tell all your friends, celebrate free classes. All right, that's number one. Number two, I just want to give a little shout out for hope for some of you. This wasn't the topic I was going to talk about today, but I just have to share it. I just got off of a follow-up session with one of my clients who is 92. 92, she came to me at 91 because she had heart failure and was developing kidney problems. Kidneys were failing, and she's not ready to die. She has a full life in her 90s. And within a few months of working with me, her kidney function's up 21 points. So she is now so close to the normal range. She doesn't have to worry about any dialysis or anything. She was able to get off of her heart failure medication, her blood pressure medication, all the swelling went away, and she feels amazing, and she's 92. So if a 92-year-old can heal her heart failure, her blood pressure, and her kidney disease, then you can too. And she's just enjoying it. She's eating her salad alone for lunch has a pound of cruciferous vegetables in it. That's not even counting the smoothie that she makes in the morning. She's crushing it. And she's 92. So I just got to give her a big shout out because I just think it's awesome that once again, we have an elderly person proving to us that it's never too late to reverse disease, reverse the aging process, get your health back, and enjoy your life. And also she shows that it's the quality of life that makes the food worth it. She's perfectly content eating big salads because it allows her to still go out and live her life. So she's amazing. And I just wanted to share that with you because we literally just got off the line and go. I love it so much. I want to be her when I grow up. Let's see what else. I mentioned the classes. I mentioned her. Oh yeah. I just happened to see in passing today that it's World Vegetarian Day. And it's Vegetarian Awareness Month, but it's World Vegetarian Day. And it's supposed to be a month where we talk about the benefits to human health and the planet and ethical advantages as well to eating a more plant-based diet. I do prefer strict vegetarian known as vegan or 100% plant-based because as a vegetarian, I got lupus eating all that dairy and eggs and processed crap all the time. But any step's a good step, and vegans are officially vegetarians. So I think what I'm doing now still celebrates it very much, right? I wouldn't be lupus free 20 years if I wasn't eating all these plants. So that's pretty neat. So the lesson that I actually had for you today that I wanted to make sure that all of you remember is to not believe your addicted brain. What I mean by that is, I've heard some influencers, you've probably heard this too, who will say things like, you should trust your body when it has cravings, that it means something, right? And it's the wildest thing to me. I don't know where they get this from, but if you have a craving, it means you're deficient in something and that you need to do something to fix it. You can't trust a body that's addicted to bad foods. That's like a drug addict trusting their cravings for drugs. Like, oh, I woke up today and I'm really craving alcohol. It must mean that I need alcohol. No, you're craving what you're addicted to. One, because you've now been addicted to that high. And two, because withdrawal makes you feel very uncomfortable and sick. And so when someone is trying to switch from a Western diet full of meat, dairy, eggs, processed items to something that's very clean, whether it's a high raw plant-based diet, if you're doing a hyper-nourishing diet, or even the Goodbye Lupus protocol and you're eating all the raw foods, that is a big change. That is like somebody replacing cocaine with herbal tea. Right? It's just, the body goes, excuse me, I am not getting what I want, what I'm used to, what I'm addicted to, and I don't like this new thing. So you cannot trust an addicted brain. And what it will do is it will fool you. The majority of the time I spend with my clients, because most people at this point, unless somebody dragged them in by their ear and made them see me, most people know my protocol, right? Because we released it to the public. When we wrote Goodbye Lupus, when I wrote Goodbye Lupus, my husband told me to write it and he picked the title. But when I wrote Goodbye Lupus and published it back in 2015, I knew I was giving this protocol to the public. And I wanted to do that. I wanted to give it and let it be that if someone's searching for this topic, they will find it and they can be free of lupus. And it's such a wonderful thing. It's a wonderful thing. I had a new session with someone yesterday who was seeing me for her own health issues, but said, by the way, the reason I know about you is my sister had lupus and Hashimoto's. She followed your protocol on her own using your books, your live stuff, and she reversed all of it, off all medications, healthy. I've never met her. She's never paid me a cent. All right, maybe if she bought Goodbye Lupus, I don't know if you realize, but you don't make a lot of money off of books. Most of it goes to the printing. You get a little bit. Okay, so maybe I got a few cents. But seriously, someone went out and she did it and she became free, right? So when we released this information, we knew people would have it. right? And even the online classes, I put them up for free many times a year to motivate people. That's why I do it segmented times instead of all the time, because my specialty is on top of understanding nutrition to optimize cellular function and reverse disease is on the brain. I'm a trauma specialist, a psychiatrist, and I understand how people's brains can trick them or keep them from what they really want most. And so when I see folks who have decided to invest in spending 75 minutes with me for a wellness appointment or to do something like rapid recovery, those are my programs where you work with me every day, like my rapid recovery group, 6 weeks, every day, having us look at you and see what you're doing and go through why you might not be doing what you should be doing. When I have these programs, when I see people, the biggest problem is not usually that they don't know what to eat, again, unless somebody dragged them in by their ear, because my information's out there. I've shared it. The issue is usually that they can't make themselves do it, or they can't make themselves stay with it, right? Why is it hard for some and easy for others? And the answer is food addiction, right? So when we give up our drug of choice, our brain has a fit. It's not getting its drug of choice. And so one of the things we teach people, of course, is how to replace that high. That's why my emphasis on things like really high level self-care. And in my group, I show people all the time, look at this. Your cravings were high and all you did was read for 15 minutes. That's not giving your brain what it needs. Let's go deeper and find self-care that creates that dopamine rush that's good for you, that you enjoy. Because if you're getting that high on a regular basis, cravings are less. My 92-year-old actually has a very big social life. She does a lot of things. So she's getting that constant oxytocin and dopamine from having all these things that are meaningful to her. And she eats a big salad for lunch and is perfectly content. Smoothie for breakfast, right? She's just living her life. So I've brought this up many times, but what I think really needs emphasis that a lot of people don't realize is how much your brain will try to trick you and distract you from solving the biggest problems. One is because of addiction, and two is also because of pain avoidance. So the other aspect besides addiction that stops people is that there are things going on psychologically below the surface in their unconscious or subconscious, not where they're thinking all the time, that actually is stopping them from doing what they need to do. And so I spend most of my time uncovering what that is. And that's something that I've always been good at. It makes me good at my job. It's usually very startling for people when it happens. And all of you who've seen me for appointments, you probably know, right? When I go, no, that's not why you're doing this. This is why you're doing this. And they're like, what? And then, oh my God. And then they start crying. And that's how I know I got it right, as the tears come. It's the majority of my work is helping people figure out why they're not doing it so that they can fix that and then be able to do it. So it goes from hard to easy. Once this is on board, because this is the biggest factor. If this decided it's easy, it's easy. Oh my God, just salad and smoothies. It couldn't be easier, right? Which you can eat more. If you have my recipe book, there's other things you can eat, but I'm just saying it's actually pretty simple, and simple can be easy. And if it feels hard, it's this guy's fault. The one rattling around inside the skull, not mine, yours, but I can't, your skull. I'll give you some examples that I've seen just in the past couple of days. I'll give you two from just yesterday. All right, just from yesterday. Number one, person who keeps adding a little bit of dairy to her life. She's a busy mom, trying to take care of her family, but also has serious health issues. Will eat a lot of the foods I tell her to eat, but then will eat cheese sometimes, like just order pizza with cheese on it, right? And when I asked her, let's talk about why you do that. Tell me why you're doing that. She said a lot of things that were not true, but one of them was, maybe I just miss cheese. I said, okay, now that you've gotten that off your chest, we can ignore that because it's not the reason. She's like, huh? I'm like, it's not the reason. Whatever your conscious mind tried to throw at me to distract me is not real. So let's pull back the curtain and talk about the real reason. And she didn't know, but I know how to process people through this to find it. And the real reason is, maybe I just prefer to suffer. And then she started crying. And I said, that's the reason. So now let's solve the right problem, because if we solve the wrong problem, people don't get better. And that's what most people end up doing. They believe their conscious mind, and then they try to solve that problem. If the conscious mind said, maybe I just missed cheese, I would be solving it differently, right? Okay, you missed cheese. Let's think of other things you can do besides cheese. Well, there's the processed vegan cheese, still better than dairy. There's cashew cheese, all right? Then there's like, well, if you're trying to do a raw program, maybe you use nutritional yeast. I'd be solving the wrong problem. And guess what would happen next time I saw her? She'd still be eating cheese or something else because it was the wrong problem to solve. It was a distraction from the real problem, which is that I think I deserve to suffer. I think I'm not good. And you know what? We only allow ourselves to have what we believe we deserve. And if you believe you deserve to suffer, you will never let yourself be healthy. Never. So that's the problem to solve. How do you solve it? Well, you need the right help for that. That's what professionals are for. There are therapists that can help. Sometimes you need to bring it to them. I work with a lot of people where they say, I've been in therapy and no one ever saw this that you saw in the first 20 minutes. I said, yes, but now that we found it, you can bring them this. Now that I know what the problem is, help me solve it. Of course, I work with people as well. In rapid recovery, like my rapid recovery group, the emotional work is part of the everyday work. We now have an app. So cool. I love the app so much. So now everyone in my group, when you open the app every day, it's like, here's your videos for the day. Here's your homework assignment to work on your mental health. And here's your, diet and all this, and your diet information, all this. It's like, chef's kiss. It's amazing. It's amazing. But because they're listening to my voice every day, they're in that zone. And then two, I'm working with them every day. I'm looking at what they're thinking and what they're doing so that I can find the things that they're doing wrong. And then we have live Zoom meetings where I can talk to them and find it even more so that I can bat away what I know is not true, that they don't know is not true. By the way, our next rapid recovery group is the last one for the year, October 24th. So that one's enrolling now. We're more than half full and it's filling up. We always sell out of that one. So if you do need my everyday help, please go to goodbyelupus.com and grab the spot. But if you're working on your own and you're not doing something like that, that's something you need help with, is to find the real reason. Another example from yesterday, someone who also is trying to get well and, has a busy life and will eat something like a meat sandwich. And I said, well, why are you eating the meat sandwich? Let's talk about that. And she said, it's just I'm crunched for time. I was like, oh, well, that's not the reason. And she went, what? I said, that's not the reason. You said it so easily, but that's not the reason. But let's talk about that. All right, you're crunched for time. Okay. Tell me where you get the sandwich. From my own refrigerator. Okay. When you open the refrigerator, what else is in the refrigerator? Spinach, kale, tomatoes, mushrooms, et cetera, et cetera. I said, so you have all the ingredients in that same refrigerator, make a salad, but you choose to make the sandwich. So now that we know it's not a time problem, let's find the real reason. And that's what gets their attention, is I'm able to show them that they can't trust what their brain just said. I said to both of these people, you are not a liar. Your brain is. I don't believe that you sat there and lied to me. And they didn't even know that wasn't true until I showed it to them. I said, now let's find the real reason. And we spent the rest of the session and I found it. I don't deserve this. And I'm afraid I'm going to fail and prove to everyone that I can't. That's the right problem to solve. If I solved the time crunch problem, I'd be talking about Instacart. I'd be talking about buying pre-chopped veggies to save time. I'd be talking about all these things that would not solve her problem. And she would continue to eat off plan because that was never the problem. The problem is we have to confront her fears and her self-worth. Those are the real problems. I can help you solve that problem, but I have to know the right problem. So I bring this to you because I know for many of you, this is what you're facing, is that you know what you should be doing, right? You come to these lives and you see people celebrating in the comments, which, by the way, last week, it was so fun seeing you all celebrate in the comments. Please keep doing that. There are folks who need to see it right now, right? But you see it, you know that this is what you need to do, but your brain keeps giving you reasons why you can't. Maybe you say you're too old. Well, just talked about a 92-year-old who's doing it and got off of all of her medications. She is the only patient in her doctor or any doctor's office who at 92 has reversed her heart failure and her kidney problems and came off of her medicines instead of needing more, right? Maybe you tell yourself you're too busy. Yeah, I did this when I was an intern, working 30-hour shifts multiple days a week, over 80 hours a week working, but I did it because it wasn't about time, it was about what I prioritized, right? Maybe you tell yourself that you just miss your old foods too much. But the thing you must understand is your brain, number one, is addicted to your old foods. And number two is trying to save you from feeling pain. The reason those folks said things that weren't true without meaning to, like I said, I think these are both great people I saw. I can't wait to help them further with solving these real problems. It's my favorite thing to do. So I have so much love and respect for them. They didn't lie, the brain did. Why? To deflect pain. Because those deeper things, when I said what the real issue was, don't you feel how painful it would be? How painful is it to think that you need to suffer? How painful is it to think you don't deserve to be better? How painful is it to be so afraid to fail that you sabotage yourself? Those are deep wounds, and those two folks aren't the only ones who feel them. So do many of you. And so your brain tries to protect you from the pain of those wounds by distracting you. Oh, it's this. Look over here. It's this. No, over here. It's this. It's not that. It's not that. So I encourage you to really try to focus on what you need to do and bat away the excuses. Bat them away like a fly that's buzzing around too close to your lashes. Bat them away so that you can get to the work you need to do and get to the results you need to have. Because if all of these other folks can do it, then you can too. And it's so, so important that you do, because this is your life. And your quality of life is not based off of cheese, and it's not based off of sandwiches. It's based off of health and what you do with your time and your relationships. That's what creates the quality of life that you want. So I hope that little lesson there encouraged you to dig a little deeper for yourself and to really start looking at, like, all the excuses I give myself. Are those real? Is that really what my issue is? Can't I do this too? And if you can't, then get the help you need. Like I said, this is my favorite thing to do. All of my people in my rapid recovery group, they pretty much everybody who comes to the live meetings, which the live meetings are every week, will stay on for everybody's coaching, because every person that I process through this, they learn from as well. And it's a beautiful community where, one, they get to work through their problems together and support each other. And it's beautiful because they're all healing these kind of deep wounds as well as health wounds and anxiety and things. And two, they celebrate their recovery together. So we're in the final week of the current group. And it has been so cool to see people who are stronger and not having pain and off of medications and, no more rectal bleeding or bowel movements all day from Crohn's disease and all that. I mean, it is so beautiful, and they've done it together. So that also helps them combat the anxiety of maybe this doesn't work, because you can't say it doesn't when you're in a community watching people heal, right? So when myositis is like working out and getting stronger and up on her feet, like, these are real people, real results, and they're sharing it together. So it is something that is so beautiful, and it is something that's my favorite thing to do. So we are going to have like a couple weeks to kind of regroup and rest, and then we're going to start our last group of the year, which I'm really, really excited to do. So one way or another, make sure you get the help you need, bat away the excuses, watch the classes, get the information, and then actually take action. In spite of anything that says, take action anyway. And that's how you get to the result. That is so, so important. All right, let's see here. All right. Oh, I see some celebrations coming through. So I always like to celebrate with you. So let's see. Maine Coon Mama. Those are cool cats. I love them. Right here says eyesight and menopause symptoms are gone. I think you meant eyesight problems are gone, right? I hope your eyesight's not gone. eyesight problems and menopause symptoms gone, because that would be really bad if your eyesight went away. But most people find that their eyesight gets better, glaucoma is reversed, vision gets better, glasses need to be replaced. It's pretty awesome. All right, let's see here. Oh, some of you like the 92-year-old success. It's pretty cool. She's awesome. She is so awesome. I love it so much. All right, let's see. Let me go back up to find the questions that we have going on. All right. Let me go to Smoothie Shred first. And I apologize, Smoothie Shred, that for some reason it didn't want to stream today, but we do the best we can, right? Let's see if I can still see questions in there. Okay, perhaps you went to the main Facebook page, which is probably the easiest way to do this right now. Okay, so let's see here. So if I go to the main Facebook page, thank you for all of the congratulations on my 20 years. It is pretty awesome. Bloggy says, you have circles, get sleep, self-care. You know, me? I don't think I have circles. Maybe the lighting's not that good. I had a great night's sleep last night, but thank you for trying to be loving to me. I'm going to take it as loving. All right, let's see here. Let me see here. Okay. Aphrodite, I'm scheduled for an upcoming surgery. I wanted to ask if I need to stop taking flax and chia seed 14 days prior to my procedure. No, that has been shown to not be necessary. So, and thank you, Carolee, on my lupus free. Yeah, 20 years. All right, let me see here. All right. Roxy says, my TSH has gotten higher since starting to drink more than 64 ounces. I'm taking my iodine supplement. My issue is cramping before getting up in the morning. Do I need to take calcium supplements? So the causes of leg cramps would be typically, if it's not because of medication, like when I was on prednisone, the worst leg cramps ever. I mean, I literally would sit in a hot bath to try to get my legs to relax. One time I did it fully clothed because it was so painful. So sometimes it can be medications. Sometimes it can be something like electrolytes. So medications, then dehydration, which on my protocol there shouldn't be dehydration, then calcium, potassium, and salt. Calcium and potassium are already in all the foods, so salt is usually the problem. So if you've increased your water intake but haven't had sufficient sodium intake, that can cause cramping as well. So I would try that. Make sure you're having some sodium with your water, especially in the evening, and see if that makes a difference for you. And I'm glad you got on the iodine because it is very important. All right, let me see here. All right, and then we have that's not a question, that's somebody just spamming. Oh, thanks for the compliment, Jeannie. Jeannie says I look amazing, so I appreciate that. Can't please everybody. All right, let's see. All right, looking over at Instagram. Does food improve irregular heartbeats? It can. So sorry, I'm cranking my head around to see. I have so many windows open to see all the different places. It can. So for example, we've had people reverse AFib on our program, but it would also depend on the reason for it. So I can't say for sure that your irregular heartbeat will improve, but your heart health will. So that's always good. Jazreen wants to know, how do you go about introducing babies to allergens if raising them plant-based? Do you still recommend introducing them to dairy and meat to see if they have allergies? Absolutely not. No. I think that's really overdone. I think one of the reasons that babies have all these allergies is because they are being raised on processed items that are not foods, and the body identifies it as non-food and then creates more sensitivities and allergies. So, and things like dairy can really cause these kind of problems. So no, not at all. I mean, for my kids, I just started them on real food. So I started with avocados, bananas, other vegetables that I could blend up. They got plain. If not, then I would blend it in with some breast milk. And then once they were one, then I even introduced things like nuts, like their 1 year birthday cake, because they were still raw, was, made from raw foods, including some nuts and things, and I never had any problems. We also don't have a history My family have things like nut allergies. I would think that if you do, then might be a different testing protocol for that. That's not my area. But no, I would never say, here's some poison just in case you get exposed so that you won't be allergic to it. I don't see that being something that you need to do at all. Let's see here. But yeah, most people start there. I mean, my own pediatrician told me to give my babies processed powdered rice cereal for their first food. I said, why would I give them something completely processed for their first time ever eating? That's just not something I would ever do. Thank you on the happy anniversary, Lady Light. Pink lemon drops, eczema help for kids, please. Make sure they're not on any dairy, first of all. Remove processed foods and sugars. Give them whole food, plant-based. So unprocessed plant-based foods. Include as many raw foods as you can, things like smoothies, and that inflammation should come down. Thank you, Miss Kimberly Edwards. Thank you, Missouri 12. Thank you, Neela Yoga. And Mitzi Clendening. Instagram is always very, very positive. Missouri 12, I know my 8 and 10-year-old would improve skin issues on their smoothies and nutritional plans, but they find it so hard to eat and drink. How to get started, please? Well, one is do it with them. So I have found with kids, one of the best ways to get them into it is to let them be a part of it, to say, okay, we're going to make a smoothie together. Pick which green you want to use, pick which fruit you want to use, add maybe some unsweetened almond milk to add a little bit of taste. It's okay if you're using a bit more fruit for a kid that's not having any health issues where you have to do a strict protocol. You can also help them design all the different salads. I find at that age, they like salad bar night better than they like a prepared salad. So when my kids were little, we did salad bar night where I filled up all the bowls of all the different vegetables, maybe a little bit of chopped fruits, and always a little bit of olives or something. And they would take their bowl and just fill it up however they wanted. So salad bar nights are a really good way to do it. But I find that kids are more likely to eat what they prepare. Show them my Goodbye Lupus, Hello Delicious book, see if they want to pick out things that they want to try and let them help prepare it. And that usually really helps. Okay. All right. Oh, Dr. Khan, thank you. Happy New Year to you too. All right, let's see. Nua Siseho. Hi, Dr. G. How many cases of myasthenia gravis has the protocol healed so far? I don't have those numbers in my head. I don't know off the top of my head. We've definitely had, all right, I'm trying to think. I can think of 2 people right away in recent rapid recovery groups. But we've been doing rapid recovery since 2017, so I don't have a number. But I can definitely tell you that we've had improvement of myasthenia gravis doing this program. But I don't keep all those numbers in my head. Let me see here. All right, +1 every day. That's awesome that your uncle reversed his lupus as well. All right. Jane Elizabeth, when I switch from flax oil to flax seeds, I get sleepy after I drink my smoothie. Can it be the seeds versus the oil? That's strange. My guess would be it might be related to feeling more bloated and full because the seeds tend to, so what the seeds will do is they're very high in fiber and they're going to increase the bulk in your stomach. And then also the seeds absorb water and might gel up. So you might just feel that kind of more full digestion feeling is my guess. And then Nikki Hughes says, is systemic scleroderma the same as Fasciolus lupus, or are there differences between them? Congrats on 20 years. So glad for you, Thomas. No, it's the same protocol and we've had incredible speed as well. So in my classes online, as well as in my book Goodbye Autoimmune Disease, we have case studies in reversing scleroderma pretty rapidly, actually. I mean, for you to be able to visibly see a difference. We had someone with very severe late stage scleroderma who had to get physical therapy multiple times a week just to be able to move. She couldn't open her mouth. Thank goodness for smoothies. She couldn't raise her eyebrows. She was so stuck. And within 2 weeks, her physical therapist measured that she'd had a 20% increase in skin elasticity. And in our rapid recovery group, by the end of it, she did 2 rounds. She was doing so well, and we were working deeply on a lot of the emotional issues. You can only imagine what it's like to go through the world with that kind of late stage disease. But by the end, she could raise her eyebrows, she could smile, she could open her mouth. And she said she never knew she'd be so grateful just to be able to have wrinkles on her forehead, because with scleroderma, it's kind of frozen. And by the end, she could wrinkle them up. So it's really, really worth doing. All right. let me go back over. I didn't forget you, YouTube. I'm coming over to YouTube. All right, let's see. Soul Tides. Hi, Dr. G, you're the best. Thank you. If you're insulin resistant or type 2 diabetic, do you need to keep the fruit lower than 25% or low glycemic fruits? I have a few family members try it. Thank you. I have not seen that be the case. It can be, in the beginning, the first week, week and a half, up to the second week, you're still insulin resistant. So eating more fruit might cause your average blood sugar to initially look higher. But then after that, as the saturated fats are released from your muscle tissue, your insulin receptors, it actually dives. And usually by the third week, people must lower their insulin usage or other medication usage because their blood sugars are too low to continue at the same dose. So very, very important to monitor your blood sugars very rigorously every day so that you only take medication that you need. But no, they do not have to switch to using those lower glycemic fruits, in my experience. You can, if you don't want to have that initial lump, but I have not seen it be necessary. Hello, Potatella. How come my doctor said I should not take my iodine supplement at the same time as my levothyroxine? What about salt water with levothyroxine? I can't tell you why your doctor said that. You got to ask your doctor why you said that. I don't know. I'm not going to make up what other people are talking about. What about salt water with levo? So salt water has nothing to do with how well your thyroid medicine works. So that's all right. Okay. Good afternoon, Miss. Let's see. Straight folks. Let me hear. Quicks PR. I was belching a lot when hypernourishing, and I had a strong garlic taste afterwards. I felt nauseous. Have you heard of anyone doing hypernourishing and having that happen to them? Thank you. Belching a lot? Sure. Depending on how much you're eating at a given time, you could have belching, you could have stomach upset. In order to use nutrition to reverse disease, you have to put all of it through here, into that stomach, into the intestines. And so the most common objection comes from the digestive tract. Like, what are you doing? So while most folks find that they quickly improve their digestive health, many have a rocky road in the beginning. And the first 2 weeks at least of rapid recovery, most of the issues people have besides the mental, emotional, motivational is digestive. And so I spend a lot of time making sure each individual has a plan to help what their specific issue is. I don't know why you'd have a garlic taste without eating garlic. I'm wondering if you're equating it maybe the bitterness of kale or something, but if you're belching a lot, I would try mixing up different ingredients and also make sure your meals are smaller and maybe every 2 hours have a smaller meal rather than a big meal that fills you up so much that you feel like you have more belching. All right, let's see here. All right. Thank Kozahara. I've been drinking smoothies for 3 weeks and drinking 96 ounces of water. I was feeling lightheaded, so I decreased my water to 50 ounces. However, I vomited twice due to constipation. I weigh 113 pounds. Okay, make sure that if you're drinking all that water, you are also getting your sodium intake. If you drink water and you feel lightheaded, you've probably dropped your sodium concentration in your bloodstream. I talk about this pretty much every week, that the general medical advice out there is to have lower sodium because most people are eating piles of sodium every day, all right? And it's not good. But there is a minimum amount that you actually need for an electrolyte. You need it to function. You need sodium for your blood to work properly. You need sodium for your muscles to work properly. You need sodium for your brain to work properly. And so when you don't have enough sodium in your bloodstream, you will feel lightheaded, dizzy, you could faint, as well as having things like muscle spasms. So my intuition tells me that you were drinking all that water, but you weren't getting enough sodium. Because even someone who's 113 pounds could tolerate 100 ounces or more of water, or even up to a gallon of water if they were getting the right amount of electrolytes as well. But if you want to cap it at 100 ounces, you can always do that and say, well, my usually smoothies have about 35 ounces, but let's say it's 30 ounces of water. And then after the smoothie, then you have 60 more ounces to go. And that would be perfectly fine to meet your plan, but make sure you're also taking in your sodium intake. I don't know if you vomited because of constipation or if you vomited because of your body trying to get rid of excess water from having low electrolytes. If you have constipation, that's a whole nother issue. Maximizing water helps constipation. Food spacing can help constipation. Sometimes people get constipated because they suddenly stopped all caffeine because they were trying to be healthy. Caffeine is a laxative. If your body's used to it and you stop it, that'll make you constipated and headachy and irritable, and then you blame the program, right? So there's many things to work on there, but for the most important thing, feeling lightheaded, that would be what you do. All right. Does soy cause moobs in men or boys? Should males eat or drink better protein instead? Moobs would be the vernacular for man boobs or female-like breast tissue on men. Absolutely not. In fact, most of the men you see that have excess breast tissue that look like feminine breasts are obese, right? They're obese and they are taking in an excess of fat. And when you have excess fat, what happens is, number one, the fat can form in the breast. Number two, excess fat can convert into more estrogen, which then can create the moobs you speak of. Tofu, soy does not cause that. The reason that misconception exists is because soy has an ingredient that sounds like estrogen, and people who are not educated in nutritional science misunderstood it, but still promoted and propagated it. And as you all probably know, once something is on the internet, then people just share it like it's a fact. But look at the cultures where people eat a ton of soy, like in Asia, you do not see men walking around with breasts. My husband, who is half Taiwanese, grew up eating tofu every day, still does, and he is extremely muscular, no moves. Tofu and soy products have something called phytoestrogen in it. I've done YouTube videos explaining it. You could look for phytoestrogen, PHYTO. Phytoestrogen actually blocks the binding of estrogen to estrogen receptors, which makes you have less exposure to estrogen, not more. So if you want to get really manly, really fit, and lower your estrogen exposure, eating a plant-based diet high in things like tofu will actually help you have better fitness and less fat and no breast tissue. Animal products, the other thing to be aware of is things like beef, oftentimes comes from cows that are no longer being used for dairy, female cows that have been pumped full of hormones to make more milk. But when you're eating these female cows, you're also getting the estrogen that's in their tissues. So you're actually going to have less estrogen in your body when you eat a plant-based diet. You can have whatever tofu or soy products you like as part of your health maintenance program, and you're getting super, super high quality protein that you can build your muscles out of, and they will not cause any kind of excess estrogen. All right. And the more you know says, thank you from the bottom of my heart. I'm wondering if you can just do smoothies. I'm having some teeth issues and want to make it easy on my teeth. And yes, we've had folks, thank goodness, that you can do the Goodbye Lupus protocol, the Goodbye Autoimmune Disease protocol with just smoothies if you want. You do not need to. Some people misunderstand. You don't have to do smoothies at all, and you can do the program. But yes, you absolutely can. So we've had folks, one with dental issues, do it that way. We've had people who, as I mentioned, like someone with scleroderma, couldn't open her mouth fully, smoothies. We've also had people who have pegs where they have their food directly put into their stomach or their intestines, and it has to be a liquid, smoothies. So yeah, you can absolutely do that. Of course, when your teeth are fixed though, enjoy going back to crunching and munching again. All right, let's see here. Go around back to Instagram. Niami says, I have kidney failure due to IgA and I'm on dialysis. Can I get out of the situation only eating green? I can't do a lot of fruits and some vegetables because of potassium, and I can't drink too much. So I have helped people reverse IgA nephropathy. Let's see, trying to look at you. And I've helped people who are on dialysis. We usually have to meet for me to design your program because I have to see what you're able to tolerate. You're not going to be able to do the full amounts of foods that people with normal kidneys can do on dialysis, because you can't tolerate all the potassium, for example. You can't do all the water because you would store the water in your body because your kidneys can't get out the water. So I've helped people in these stages, and I usually have to design it for you. But what I can say is you can totally still do the program. You would have to find out, if you were doing it without me, the best you could do would be to say, okay, how much can I eat of the lowest potassium, high nutrient vegetables, which would be cruciferous vegetables, making sure that you're getting in the cruciferous vegetables that you need, that you're getting in the omega-3s you need, like with chia seeds or cold pressed flax oil, that you drink the water that you're allowed to drink, and then using lab tests to make sure. So I like to watch people's labs. Like if you're in my rapid recovery group, which usually people on dialysis, if they're going to do this, they'll do something like my rapid recovery group, so I can watch them and then look at their labs weekly. And when I'm looking at the labs, then I'm able to say, you're tolerating this really well. Let's go for it. Let's increase this. Or, you know what? I don't like that potassium's kind of here. Let's decrease this. Let's fix that. So that's really how you have to do it for kidney failure. All right. Visionary trend. Can after one eat their big bowl of salad, can we have cooked veggies? It depends on what you're trying to do. So if you are trying to improve your nutrition and you don't really have a lot of health issues, then yeah, have your salad, your smoothies, all the raw foods to get your nourishment in, and then totally enjoy your cooked vegetables. And for many people, doing that also is effective for disease reversal. If they're truly hitting hypernourishment guidelines, then even if they add some cooked vegetables, they have dramatic reversal of health issues. It's just more variable that way. Versus when people do the full Goodbye Autoimmune protocol, I can say, okay, this is the one that is going to give you the results. That if your body can get better, this is the way it will get better. Whereas if you get great results with a little bit of cooked vegetables, we are very excited, happy, thumbs up. But if things, kind of get stuck, always the next step would be to take out those cooked vegetables and to go all in on the protocol. All right, let's see. Armand says, my wife is a lupus patient. She recently purchased all 4 of your books on Amazon. Some of the greens and vegetables you recommend are not available in Sri Lanka. Can you suggest suitable in Sri Lanka? Well, all you need to do is use the ones that are available. That's all you gotta do. There's nothing else to do, right? Is you look and see, all right, here's the list of cruciferous and high nutrient vegetables, right? So anything cruciferous, and then spinach can be added to the group, and then you go and see which ones you can get. And then you use the ones you can get, and then you substitute the vegetables you can use for the ones that you don't have. That's it. No other thing to do there. That's all. All right, let's see. Landis Dana, can Thomas look at my diet and labs and help me with the Goodbye Lupus protocol, or do I need to book with you? Can I get SSA and ANA? Can I get my ANA and SSA negative? Thomas can definitely look at diet, and he can optimize that for folks, but he can't read your labs. That's not something that he'll do. So if you need labs read, then you would want to see me. One thing you can do if you're already working with me is you can always send labs. Everyone I'm working with, I give you my cell phone number. You can always text me and say, hey, I got some updated labs. I'm happy to check those out for you. So if you need to be on a special plan because of those labs, like you got kidney failure or something, then you want to see me. But if you don't have any dietary restriction, and you want a protocol that can work for autoimmune diseases or metabolic diseases, he's great to see. So it's really the people who have to restrict what they're doing because of organ damage that really need to see me, or if you need labs interpreted, that's something that I can do, but he can't. All right. Ms. Clendon, I don't have any updates on the FDA issue you're talking about. Sorry. And then Landis Dana also added, I can live with shakes and salads, but never satisfied. So that is such a great statement that leads back to my opening discussion, right? In the beginning of this was about how if your life is really satisfying, it's easy to keep the food simple. If you're not, if it's not, then the food's going to be bigger issues. So when people aren't satisfied, here's the reasons. One, you're not eating enough, so you actually are still hungry. Sometimes people will stop eating because they don't feel like another salad, but they're actually still hungry. So if you make sure you're always full, and if you're always full, but just kind of wish for something else, then just I would look into making your life more fun so that you can let your food be simple. Do some really fun self-care. So have your smoothie or your salad or any of the recipes in my Goodbye Lupus All Delicious book, right? Any of those. And then go do something that makes you feel really satisfied with your life. That would be the next best thing. All right. Sit back down. Let's see. We still have time. I'll go back into Facebook. Let me find the next question from Facebook. Let's see here. I'm reading all your congratulations. That's why I'm smiling at you there. All right. And thank you, Jeannie Camacho and Rosina and Anna. All right, let's see here. All right. Letitia Benton Bell says, good afternoon. You mentioned that with your kids, their blood pressure and cholesterol can look low, but that's actually a healthy normal. What would be considered safe or acceptable low blood sugar? My twin Natasha submitted the question last week because her husband was recently diagnosed with diabetes. He's now off all short-acting insulin, is decreasing the long insulin each day, providentially. Your videos popped up on my Facebook feed that week he was diagnosed, and then it got cut off. There's only so much this app can hold here. So when you are not on medications to lower your blood sugar, we don't worry about it, right? So most folks who are eating on my protocol, their blood sugars stay pretty level and on the lower end, but they're feeling good. When you're on sugar lowering medication, then you have to be more attuned to that because you could cause it to be pushed lower than it should be. And that's for your doctor to help you with. So if you're taking a blood sugar reducing medicine of some kind, whether it's insulin or other medicines, then you need to talk to your doctor about where the danger zone exists versus sometimes I've seen people lately getting these continuous blood sugar monitors that they did not need to have. And then they're worried about alerts where their sugar's on the low end, but they're walking and talking and feeling great. And then they're thinking they need to go drink a soda or something. No, you're fine. Most normal healthy people don't know where their lows are. I don't know what my low is. I'm guessing overnight my blood sugars are probably lower than a lot of folks, but I wake up every morning feeling normal. So, but if I'm happy that he's getting better and decreasing his insulin. I would be working with the doctors on that. And also know that you should only take it when you need it, right? And so that helps if people are monitoring their blood sugar and don't take it when the sugar's already low. And if it is low because you got too much insulin, then you can use things like fruit. It doesn't have to be candy and it doesn't have to be juices. You can use fruits and things and just have that all available for yourself to bring up the sugar in a more healthy way. Of course, if it's a severe emergency, someone overdosed, that's a whole nother story, but that's an emergency. All right. All right, so let me see here. All right, let's see here. All right. Okay, let's see. Okay, Joanne from YouTube. I recently went to a rheumatologist, had labs done. My creatine kinase was low. My complement C3 and C4 were low, 118 and 17. Can you explain what that means? Thanks for all you do. Creatine kinase, not worried about that. It's worrisome when it's high. That could indicate things like muscle damage to skeletal muscles, to heart muscle. Low, we don't usually look at. C3 and C4 being low usually indicates that you've had chronic inflammatory issues going on. So C3 and C4 are proteins involved in your inflammatory immune system, and your body actually makes those. So if your C3 and C4 are low, it means that you are using up these inflammatory proteins faster than you can make more, which is usually what we see in chronic autoimmune diseases. And then as people's diseases go away, like in my practice, when they reverse their diseases and get well, then those complement levels come back to normal. And that's how you know that their immune system is calm. Okay. Deborah says, how do you get all your chia and flax in if you don't do smoothies? Are hemp seeds okay? So hemp seeds would not be part of hypernourishment because they're more omega-6 than they are omega-3, but they're fine in maintenance, step down in maintenance. How do you get it in if you don't do smoothies? You can do things like chia pudding or flax pudding. You can even use flaxseed oil like a supplement and just take it off a spoon. There's a lot of recipes for different chia and flax puddings in my recipe book as well. Let's see here. All right, Mary, that's an interesting question. Thank you for the compliment. I'm not going to read the compliment. It's embarrassing. How do we support people we love without attachment? That's an interesting question, and it makes me wonder why you're trying to be detached from someone. How to support people we love without attachment. I'm guessing you mean without attachment to what they do. So I have talked about before how sometimes you know somebody can do better, but they're unwilling, but you can love them anyway. And that's definitely something important. But also, you have to make sure that whatever it is they're doing doesn't directly hurt you. So if they are doing something that is harmful to themselves, but it doesn't have a negative impact on your life, then, and besides the fact that you worry about them, then all you can do is speak with compassion about, I'm so worried about you. I'm afraid I'm going to grow old without you. I'm afraid I'm going to have to take care of you when you get sick because you don't take care of yourself, right? The second one, though, is one where it impacts you, right? So let's say you have a friend or family member who lives on their own and all that, and you feel worried about them, you express it that way. But when it impacts you, I think there is some attachment. So, for example, if it's a spouse, it's like, hey, you're not taking care of yourself, and when you get sick, I have to take care of you, and that scares me, right? We have that confrontation. But they need to know that what they're doing impacts you. You still love them, but you are attached to the outcome. The outcome affects you. So it really just depends on the situation. You know, I've had a lot of clients and patients where they got better with me. They're living in their healthy life, and then they have a sister or brother or aunt or uncle or something that's also sick, and they won't listen. And I say, okay, all you can do is share the information. And if they're not willing, you love them anyway. It's still going to hurt you on some level to know they could do better, but we each have to make that choice for ourselves. Like I said, the biggest issue is whether or not what they're doing is harming you or your family. So if it's harming you, like I can't go and live my dreams for my self-care and for my life and for my future because you keep getting sick because of what you're doing to yourself, that is something that you need to be attached to, right? That's important. But also whether or not it's other destructive behaviors that could be harming you or your family. Those are different. Those require interventions. So it just depends on the issue. It's in something like that, I feel like I have to have a specific scenario to give the best advice, but that's my general version of it. Let me see. Oh my gosh, this is such a great one. I love this. The most common thing I help people with is their thyroid because it's one of the most common autoimmune disease there is. So if you want to check this out right here, it says, I'm celebrating, I'm healing craves, and today I got good news that my thyroid levels are going down and I can reduce my medication. The doctor was confused, and that's just on hypernourishment. That is fantastic. I'm so happy for you. And we've had a lot of people reverse Graves' disease as well as Hashimoto's. So it's absolutely fabulous. All right, let's see. All right, here's another one. Look, see, people are just celebrating that. Thyroids love this. And isn't it so interesting, right? You see this right here, and then realize that people will find online or even sometimes from their healthcare provider that people with thyroid issues should not eat raw foods or cruciferous vegetables. And they're preventing them from actually reversing their disease. It says, I went from hypo to normal. T-shirts after 6 weeks. So good. She wrote T-shirts, meant TSH after 6 weeks. I was like, oh, we're gonna buy T-shirts. I thought you were gonna buy T-shirts to celebrate. But normal TSH 6 weeks is so great. Absolutely awesome. Oh, Monique watching live for the first time. Welcome. And thank you for all of you who are sharing all the successes here. I think that the community that's formed here, even those of you who come to all my Wellness Wednesdays, I'm seeing a lot of the same names, and I'm seeing new ones, which makes me happy too. It's so happy to see all of you here. For those of you who came in late, I encourage you to watch the beginning. I did some coaching in the beginning about the ways your brain tricks you out of this. Also, some cool news about update on my 92-year-old client who's reversing her heart, who has reversed her heart disease, is reversing kidney failure. And also a reminder that my online classes are free now this month. I'm celebrating 20 years lupus free as of this week. And that's a really big deal for me. And I want it to be your motivation to do it too. So if you go to goodbyelupus.com, if you like just watching Wellness Wednesday, well, I've got a treat for you. You can watch my online classes. They've been around since, I think, 2017, but the information is still good. It's still healing. It's just a different haircut. So enjoy the online classes, share it with your friends and family, have watch parties, and make your anniversary the same as mine. We can celebrate every year together. So I hope you have a great rest of your week, and I hope this helped you out, and I'll see you next week. And remember, for those of you who are going to be working with me for my group, the final group of the year is starting in 23 days. So if you are interested in that, goodbyelupus.com. If you're not looking for my help, but you want free info, also goodbyelupus.com, get those classes. And I'll see you next week, everybody. Bye.